Welcome to Medical Confessions,
your remedy for serious medicine. I'm Jen.
I'm April.
And I'm Scott. Have you ever wondered what the deal was with Kegel exercises and why it's such a thing? Do you have a urinary incontinence after pregnancy? Did you think it's only for women? Men? Can you do Kegel exercises? 2 words, prolapsed rectum. You might want to think about some Kegel exercises.
There's a lot of interesting phrases and taglines in this one.
Like prolapsed rectum?
Or just Kegels. Like, that whole thing's just weird. Well, what's the history on the Kegel?
Arnold Henry Kegel first published his ideas in 1948. He was an American gynecologist who invented the Kegel perennometer. How do you say that, Scott?
Perennometer.
Perennometer. An instrument for measuring the strength of voluntary contractions of the pelvic floor muscles.
Does it show a picture?
No, I don't have one. I'm sure you can look it up.
I'm thinking of like a metronome / like a luggage weight.
Well, do you remember the episode on like coffee making you poop we did, and they stuck anal probes at people and measured the rhythmic contractions? It's got to be something like that. Just a probe that goes up and go ahead, squeeze.
Well, I'm thinking of like a grip strength analysis, like, you know, like you do for physicals or whatever, like where like people are really like get competitive and they're like, oh, well, they're squeezing their hand really tight. You know, this is one of those things where like their face is moving, but you know, you can't.
Nothing's happening. Like that YouTube video.
You can see. Yeah. Sorry.
That's about it.
So basically, he's just a doc that came up with how to measure the strength of those muscles.
And Kegel exercise is Kegel exercises as a non-surgical treatment for genital relaxation.
Oh.
That's what it says.
I wonder what his family with that last name, you know, like his heirs, and they're like, Kegel. Gosh, why couldn't Grandpa have studied, you know, like, why couldn't he have discovered TVs? Or like,
So what is Kegel? What are they good for, Scott?
Yeah, why do we
tell
need
us the science behind all this?
Why should I get over my discomfort in the term?
Well, so you've got your pelvis, right? And you've got your pelvic cavity, and it's holding things like if you're a girl, it's holding your uterus, it's holding your bladder. It is the bottom floor of your pelvic, so they call it your pelvic floor muscles. The muscles actually, the main grouping of them, they're called levator ani, but they're made up of a few other types of muscles, like your pubococcygeus muscle and your iliococcygeal muscle and your coccygeus muscle. Anyways, and they just together make up the floor of your pelvis. It holds all the stuff up, and just like any muscle, if you use it, it's going to strengthen. If you don't use it, it's going to atrophy and weaken.
You pointed at me when he was atrophy.
You're older.
So
Have you been practicing your Kegels?
No.
And anyways, and so that's what their purpose is, right? It's holding up all that stuff. And, and so some of the nerves involved also is your pudendal nerve and your pelvic nerve. They kind of supply the signal from your brain to these muscles to contract, you know. And so what's happening, you know, the biggest thing with urinary incontinence, especially in pregnancy, so we'll just talk pregnancy specifically, you got a big baby coming out of a tiny little orifice there, and that baby is going to put pressure on the muscles and the nerves there. Yeah. And the longer you put pressure on any muscle or nerve, the greater more difficult it is to get blood flow to that, right? We talked about putting pressure on your nerves. You don't have to put that much pressure on your nerves for your limb to fall asleep. And same thing here. So if you're putting tons of pressure, so like you're having a contraction and you squeeze and bear down to try and push the baby out, you're actually, studies have shown you're getting about 3 times the amount of pressure by bearing down than if you just let the contraction do itself. So you're supplying tons of pressure on these muscles and this nerve damage. And if you have long labors, and so this stuff is happening over long periods of time, you got an increased chance of having damage to the nerve or the muscles. And so the recommendation now by a lot of OBGYNs is don't
C-section.
Yeah. Well, and actually it is helpful, but but you can still anyway, so what they're saying is just don't push during that contraction. Let it happen naturally.
That's not what they tell you, though.
Well, and it is,
Right.
it's changing. Same with the episiotomies, right? Like that, the thought is that, you're going to reduce the chance of having damage if you can do a nice, clean incision versus letting it tear on its own. But the studies are saying you've got a greater chance of having urinary incontinence and muscle problems if you do.
All I can think back to is when we talked about bowel movements, and April suggested that you learn how to just let it happen naturally.
No, yeah, that's exactly what I thought of too. That I can't even imagine being in that much pain and then not pushing. Like
Well,
I can't even
wonder
do it
if
when I have a
that's-
bowel movement.
I don't know
hardly.
anything about hypnobirthing, so I'm just going to get torn up on this. But I wonder if there's something there, like if there's already a group of people that kind of practice that, like breathing through the pain and just like learning to, and not
sure.
actually creating more. By
Well,
doing. I don't know that pushing creates more pain, but.
Well, and what's the risk benefit, right? I mean, the benefit to not pushing is you're going to reduce your chance of having urinary incontinence and muscle problems that will cause prolapses down the line. But, again, that chance is still pretty low overall anyway, so just start talking numbers. 1/3 of first pregnancies will come with urinary incontinence as an issue. Because the baby's pushing on the bladder, that's pushing on these pelvic muscles, and, so you're going to have bladder issues. But if you have more than one pregnancy, your second pregnancy is going to be about 3/4 of those women have urinary incontinence.
Oh, I feel lucky.
Yeah.
Of all of those, only about 5% of women still have the problem
A year
once
later.
all of that stuff is healed. So it really is a low percentage, but it is going to increase your risk. The longer you go in labor, the harder it is, the more pressure you're putting. So things like forceps. If a doc uses forceps, so that puts more pressure on all of these muscle groups, and so you'll have an increased chance of having anal
You just see all the
muscular
discomfort
problems.
all over my face. Like
So
all this
glad I'm
sounds-
not currently pregnant and listening to this podcast. I would
All
be
this
like,
sounds terrible.
Yeah.
Like so painful, and I'm like, oh god.
Well, and so some of the more serious things you can actually get bladder prolapses, where your bladder, your pelvic floor muscles weaken to the point where your bladder falls into your vagina. They call it a bladder prolapse or your cystocele. You got the same thing. These same muscles help with rectal, sphincter control and that sort of thing. So you got a greater chance of rectal prolapse with this sort of stuff. They call that a rectocele.
This is one of our least pleasant episodes.
It gets better.
I know. But it doesn't just happen with pregnancy, though. There's other reasons that people can have this incontinence, right? Isn't obesity a risk?
So anything that's going to cause nerve damage or not using these muscles. Age is a risk factor, right? Like the older you get, the greater chance you can have bladder problems and having problems with holding your stool in. But if you have nerve problems like diabetics, you're going to have nerve issues. If you got nerve problems going to that's controlling these muscles, that muscle's going to atrophy. So at the end of the day, it's anything that's going to cause a nerve problem or this particular muscle group atrophying.
Well,
problem.
and it's probably fairly, I don't think that everyone has them. By some of your statistics, I should have had issues. And I always joke whenever I feel like I'm a pretty hearty laugher. So if I have a really good laugh, I'm always like, I'm going to pee my pants, and I'll run and go pee because I don't want to pee my pants.
Have you ever peed from laughing?
Yes. Once when I was really young, like a 12-year-old girl, like at a slumber party, like full on laughed so hard I peed my pants.
Awesome.
And then I've done it once as an adult.
When were you at work?
No.
Oh, because that would have been awesome.
It wasn't. It was actually now like an adult version of a slumber party, kind of like for girls and stuff. And and I knew it was going to happen. And I was like, and we were drinking, but I wasn't drunk. I just had a full bladder. And I was like, oh no, but it doesn't happen regularly. Like I'm actually so scared of it that I'm like, I got to go because I'm going to go pee my pants. So I guess my thing though that's funny is there's no difference for me. In fact, I have never had an issue after pregnancy. And
great pelvic floor muscles.
Must be, but I do not do Kegels, so it's not from that.
And there's two types of incontinence, correct? Like
urinary and
stress.
Stress, yeah.
Well, yeah, so you can have it's basically going to be the cause, right? So this stress stuff is coming, that's the cause we're talking about here. Pregnancies, coughing, sneezing,
right. And
laughing,
I've never had
things.
any of the other ones, though. Yeah. Like I have friends that I work out with, and every time we have to jump rope, they have to pee right before we start, and sometimes they'll stop and go back and pee. Like tons of my friends have this issue. It's like jumping on trampolines, jump roping. Some of them are like running, like marathon runners. Like they'll pee their pants while they're doing it, but otherwise they're fine.
Yeah, so that would be the stress-induced incontinence versus
horrible.
the other type of incontinence, which is just a natural incontinence you get from like, you know, other problems.
Sure. Yeah, I've only done it once.
As an adult or yeah?
No, it was like just at a best friend's house.
Yeah.
And I think it was a junior high age, same thing. I was laughing
So hard.
but like just a little.
Yeah.
Like not full on, but it was enough to like,
I just peed.
oh my God. I mean, when that happens and it's not normal for you,
Yeah.
it stops you dead in your tracks. You're
Oh,
like,
yeah.
Oh my God. How do I remedy this situation without being obvious?
Yeah.
Well, and I
There
know
is
somebody.
I just wanted to change my pants.
I wanted to be more comfortable.
I know somebody after they gave birth, they can't run now because every time they run, whether they've gone to the bathroom before or after, it doesn't matter. They're either wearing a Depends while they're running. They just know they're gonna leave.
But there's fixes, and so Kegels is one of them, correct?
Kegels will help strengthen that, and it'll help. You know, because your ureter runs through this grouping of muscles, so if you have stronger muscles, it's going to help you control that bladder and keep it back, versus if they're loose, the bladder's or the urine's going to be able to come out a little easier. So, Kegel exercises.
Right. Well, there's a little fun fact here. Continence affects about 200 million people worldwide. The average bladder holds about 375 to 500 milliliters during the day and can hold up to 800 during the night.
Oh, mine holds like 100.
Have you guys ever been laid up in bed for a long time and then like had to use, so I was laid up in bed for a long time.
When you broke your leg.
Yes, had to use a, what do you call it, urinal.
Yeah.
And I would actually, I mean, what else are you going to do? So I had a fun game with myself. How long can I hold it? And how much pee is going to come out? So I'd measure. I never got above 800 milliliters.
Oh,
yeah.
interesting.
I could never get, I was like, I'm going to pee myself if I don't go right now. And that was my 800 milliliters.
You didn't have a smartphone, I'm assuming.
To like...
Keep yourself occupied, otherwise you were just like...
Well, I was all doped up too. Like
Yeah.
who knows the games I was playing with
You're like a
myself.
monkey.
Yeah.
Let's test it.
Scott. About 1 in 4 women and 1 in 8 men experience bladder issues, and only 1 in 12 people will seek help.
Yeah, I believe that.
Yeah, I do
like
too.
I feel like it's one of those things that women, and only because that's my experience as friends, women that have issues, I feel like they almost like it's just part of their life. Like, no, I just can't jump on the trampoline with my kids because I'll pee my pants. And
Well,
I feel
that's too
like
bad.
I understood what Kegels were before, but now that the research has been done for this episode, I'm like, oh, you can. I mean, it's like any exercise program.
Oh, yeah.
Well, and for the
You
record...
look excited.
I am so excited about this.
Before we talk about that, let's say it's good for men too, right? Like we talked
yeah.
about
Yeah.
with women. Men actually, they have, bladder issues too, especially if their prostates are enlarging and, you're having bladder control problems, or you're just having, incontinence problems in general with stool as well. Kegel exercises work for them too. They have the same muscle group that's holding up stuff in their pelvis.
That's so funny. I
Yeah.
just never thought about it being a male issue. I just thought about it being female.
Yeah, similar. So I had looked up what exactly it can do for men. It's like urinary incontinence, anal incontinence, prostate problems, ED issues, ejaculation and orgasm.
Those are like high priority.
Yeah,
Yeah.
exactly. Like performance anxiety.
Like the guys in the gym, you want to be like, dude, ignore your pecs.
Check this out.
I want to show you
Do you know
something.
how far I got this to go?
Could you imagine, like, if you just go to the gym and you just go sit on a weight bench?
Can I...
Like, people are looking at you, waiting for you to grab weights. Oh no, I'm doing reps.
Yeah, I've been asking people all week, do you do Kegels?
How does that
Round
conversation
table.
go?
It's actually people are pretty open about it.
Yeah.
Either no, yeah, sure, and then it just turns into a big joke.
Yeah.
Like,
Have
Did
you
anybody
been-
say, like, yeah?
oh yeah.
Like, I have an app that helps me track it.
Have
Not that yet.
Has it surprised you who does the Kegels?
No, I just assumed it was I just assumed that people did that on a normal basis.
Really?
Yeah.
I'm the opposite. Like, I'm like, who
I
does
do,
this?
yeah.
Really?
Yeah, I used to have Benoit balls, but I got rid of them. And I got rid of them because I just wanted to replace them, and I never replaced them. But I just do the normal, like, just Kegel exercises. But I also think that you need to be consistent at them. And
Well, yeah,
it's
like
just
any-
whenever you think about
Yeah.
it. It's like, I get lazy about it sometimes, but then I get on
Well,
the
if you
kick
don't
where
have
I'm
any
like,
problems, do you need to?
oh yeah, well, you'd want
Well-
to. Sexual pleasure for women.
But what
it's-
if you feel like you're fine? Like,
There-
if
I
you're-
mean, imagine it better. If you're
Well-
fine, I mean, who wants to be average, Jen?
Well, I don't mean it like that. I'm just like, I have no complaints in my life. I'm not peeing my pants. I'm not, like, I don't.
Well, I will say from the man's perspective, reading on this, and I should have written down the name of the actual procedure. I guess if you want to call it a procedure, I don't know. But there is a Chinese word for this thing where a woman is on top of a man and no one's thrusting or moving, but she's still stimulating using Kegel muscles.
Oh, okay.
So that could be exciting.
Well, there is also a gal named Kim Anime. Anime?
Anime?
No, Anime, I
Okay.
think is how you. So Kim Anime, she's a sex and relationship coach. She practiced what she calls vaginal kung fu up to 5 times per week and claims having a vice-like vagina is nothing short of miraculous. Like, if you look at, just go ahead and hashtags things I lift with my vagina. She's incredible.
See, I can't
Like, she's
Google that.
carving out a niche in the world.
What
But
is she lifting, like weight-wise?
I think there's a picture of her lifting like a 5-pound weight. So she has a jade egg with a hole through it that, you connect a string, and she wraps it around weights, surfboards, coconuts, like anything. And she's
I just don't see the purpose. Like, I think I'd rather like plank.
Well, as from a
well,
guy's
ask your husband if he noticed.
No, I'm just thinking like about overall health.
I see the purpose. I don't know.
I'm just thinking overall health, though, like having a fit body is beneficial in other ways as well. So,
Sure.
sexual gymnastics, it would also be beneficial to have a strong core and strong, so I'm kind of like, why would you put all your eggs in the basket?
Well, she's obviously a fit woman all around.
Okay.
So I think she's just shedding light on the topic itself, because
Okay.
I don't think it's something people normally talk about. So she's just being out there
Yeah.
and in people's face about it
I do
to
not want her to get in
promote
my face about Kegels.
healthy Kegel. Because if you practice
Yeah.
now, the likelihoods of you becoming incontinent are less. Like you're lessening your chance. So I think overall, I get it.
And then the sad thing is you'll end up with dementia and just be yourself anyway.
And everybody at the Alzheimer's ward conveniently goes by to her,
to Kim's room.
to Kim's room.
You see.
Although they'll forget about it. So
That's
it's like
true.
Well, Scott, you
Yeah.
mentioned that when we were doing research that you actually found like a YouTube video of someone demonstrating Kegels.
There is, and I should have written this down to give them credit, but it's an Australian gal who's like, it looks like she's about to do yoga. She's got the floor mat. She's in the yoga outfit. She's got this pillow that looks like
It's so funny to me
the
that
thing-
she got dressed up. for
what she
Kegels.
did. And this is why I'm like, okay, so this has got to be a full body motion. Are we sweating here? What's about
Yeah.
to happen? And it's a long YouTube video, like 20 minutes, and then she just lays down on this pillow that, looks like a liberator or
Like
something.
a body pillow kind of a thing.
More like a sex pillow that gets you in the right position, because you're supposed to have everything relaxed, like
Yeah.
no butt muscles, your glutes got to be relaxed, your quads, all of your muscles will be relaxed, and you're focused on
Yeah.
these pelvic floor muscles, which if for people who are, how do you do that? Things like if you're peeing and then you stop yourself peeing, that's the muscle group.
Okay.
If you're trying to hold back a fart, that's the muscle group. So whatever motion that is, I'll let you get into the how. But she's laying on this pillow and she's like up and down, and I'm like, but you're not even moving. What's happening right now? I don't see anything happening. And for like 10 minutes, up and down, and I'm like, this is ridiculous.
She's like the opposite of the prancer size lady.
I love that lady.
I haven't seen her.
Oh,
you
haven't?
Prancer size?
Oh,
I
gosh,
haven't looked
April.
that up.
You're going to start doing it at the mall.
Oh.
You're going to go with the mall walkers and you're going to prancer size.
Two
when she
syllables,
sees-
camel toe.
Oh.
It is
Oh.
ridiculous.
Okay. Well, so women, in order to perform the Kegel exercises, squeeze their muscles 10 to 15 times in a row, trying to hold for a few seconds. Don't hold your breath or tighten any stomach, buttocks, thighs at the same time. Each week you can add more, but be careful not to overdo it. And I'm like, Oh, what
Rhabdo.
happens if you overdo it?
Rhabdo.
Yeah.
You get sore Kegels?
Yeah.
But here's a
Sore
question
pelvic
for you,
muscles?
though. Like, I'm now interested from the training perspective. Is there different prescriptions for different people? So if you're trying to gain mass, do you do like heavier weight, less reps? And if you're just trying to be more toned, do you
For
do
bedroom
high
Olympics,
reps?
this could be
high,
important.
you know, like.
Yeah.
Well, yeah, there's actually
I was kind of being facetious.
no,
Oh,
I mean, well,
okay.
because like the Ben Wall balls, like there's now all sorts of different ones that call different things,
Yeah.
but it's specifically to tighten up and
So these, what, you stick them in and then like try to pull them out, or you just stick
no,
weights
you
on
try
them?
and keep them up. So the Ben Wall balls are weighted. You put them up there, and you're almost in a constant flex. Like when you feel like they're about to come out, you better just tighten up so they don't. But you can walk around with them, do shopping, but
Oh, what if you
wear underwear
lost
for
control?
sure. Yeah, because then they'll like just go
I
rolling
think
down
I'd
the
rather
aisle.
Just, I think
Yeah.
I'd rather just pee my pants.
Oh, you just wear them around the house, but they do come weighted in
Okay.
different weights for the beginners and the advanced. But and then if you want to get real serious, take up vaginal weightlifting. I mean, I think that's a little extreme, but
Each their own.
who
right?
knows?
Well, this does seem like a workout where you can do in the boardroom right now, right? Like when you're just having a board meeting, you need to get in a quick 20-minute workout, you can just sit there and do Kegels and no one will know.
Yeah. Do you ever get the Kegel shivers? Do you do Kegels?
I do not do Kegels.
No. Every once in a while, like if you do them, like repeatedly, I like kind of get a little shiver shake. And I used to work with people, and we were just on the computer, and we're like, "Are you doing your Kegels?" Yep.
Oh, I would be like,
Shake.
I need a new partner. I relocate my office.
The next time we're in a work meeting and I see you shiver, I'm going to
She's
laugh.
It's almost like
I'm
a
always
pea
cold.
shiver, Like,
Yeah.
like whoa.
Oh, gee.
All right. So men, men often, like sometimes women just don't know, am I using the right muscles or not? Men have the same questions. So Scott, go ahead and repeat or follow my instructions, because here's how you would do it
Okay.
for a man.
Well, Sorry,
One way to find them is to insert your finger into your rectum.
right now on camera?
Yeah, go ahead.
No, I think I'm good.
Just kidding. No, this was
My thumb or my pinky,
So
because that's
here-
going to make a difference, I'll be honest.
I'm going to read off. These are the suggestions based on a website that I think is BS. Because
Okay.
that was their first suggestion. And I was like, oh my
You
God.
can't like slowly lead people to this process like that.
Yeah. So
Go
I
straight
think
for it.
this writer was just being a jerk and
Yeah.
wanted to know, like just wanted to lead people to stick their finger in their rectum. But here's his suggestions. Stick your finger into your rectum and squeeze it without tightening any other muscles.
Yeah.
Another trick is to tense your muscles like you're going to pass gas, like you
Yeah.
said.
And
But that's just suggestion number 2. And then suggestion 3 is to stop the flow of urine,
While
midstream.
you're peeing.
And that's like the most common suggestion for men and women that I've heard. I think this guy got him backwards. I'm like,
Thinking of Dumb and Dumber.
Yeah.
I can't stop it.
It'll
Burns.
sting.
yeah. Yeah, so if you're still having trouble after the finger, fart, and pee trick, then you're hopeless and you should probably go seek your doctor.
Want to know a fun hemorrhoid fact?
Yeah, I do.
So, like, hemorrhoids, everybody says you need I've got hemorrhoids because they, inflame or something. So everyone has hemorrhoids. Hemorrhoids are a part of your large intestine that can help you distinguish whether it's going to be gas or a solid that's about to come out. And so everybody has them, but if they get inflamed, it's called a pile, but that's what everybody says. That's a hemorrhoid, but everyone has
Okay.
hemorrhoids, but a pile is an inflamed
So
hemorrhoid.
hemorrhoid's not really a negative term. It's actually
It's a thing you have,
Yeah.
right? It's like saying I have a
Oh.
fingernail.
See, I did not know that.
I didn't either. I just thought that pile and hemorrhoid were interchangeable terms.
Well, they are,
I just
because
like-
one's an inflamed hemorrhoid.
Right, but I thought they were the same thing. Like if somebody says I have a hemorrhoid and someone else says I have a pile, I thought they were the same thing.
See, if
Yeah.
someone told me they had a pile, I'd be like, of what?
Yeah. Don't even care.
Yeah, it
Gross.
is- I don't even know what that means medically. Just stop. I don't care.
Have you guys ever had to cut off peeing midstream?
Yeah.
Yeah. Have you?
A couple of times, but mainly because I'm on a long road trip and there's no gas station around and you fill up the cup. It's more than 500 milliliters.
Oh,
I'm
And
trying
so
to
you
think
have
that would
why.
be an emergency stop.
I know.
Yeah.
That's why you have to stop and
Women
make this
stop
happen.
all the time, though. Like, if you go into a women's restroom and you listen to a woman peeing, like, it's not always just like, you can hear them stopping and starting at like, it's not just a straight stream the whole time.
So, and that's not from a prostate problem.
No,
Clearly,
no, I
unless
don't. I don't even think it's a bad thing. Like, I just think it's, because isn't it true? Don't women push to release pee, and men actually have to relax? Is that false?
Oh, I don't know about that one.
I don't either. I
Yeah.
think I can just not focus on pushing pee out, but I do notice that
can
you're
push-
not supposed to stop midstream. Like,
Yeah.
it's bad for you. Like, something affects your bladders in a negative way somehow.
No, I
or
think you're
no?
not supposed to not fully eliminate. So you shouldn't. You should pee everything that you're able to pee,
So you
and not
can-
reserve it in there because
You're
that's
not
an
able
issue.
to fully eliminate. Yeah.
Right.
There's not like a medical thing that would.
Oh,
But I do
'cause
know
all
holding
of the
back pee is
suggestions
a
that-
Kegel exercise in and of itself.
Well,
You're using
well,
your pelvic
no,
floor muscles.
but yeah, every suggestion on that, they have said, here's how you find them. Like, go ahead and stop midstream, but don't do that on a regular basis. Like,
Oh.
there was a contraindication of doing that. Like, this is how you can find them, but don't make that a regular practice.
And here I'm just thinking, like, if you get a bunch of guys together in a urinal, if you could do like Morse code by practicing
Or, like,
Kegel
tapping the
exercises. Yeah. Da, 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 da.
You should make a musical urinal. That would be kind of cool. Like,
Oh,
every
different
spot
start
of
and
the
stop.
urinal would make a different tone when pee hit it.
Oh,
That would be kind of fun.
I always thought, like, again, because,
but it would probably also depend on the quantity and the force of the pee, because I know that
Sure.
varies for individuals.
well, I saw this one thing one time, that, they have urinal cakes in
Yeah.
men's bathrooms to help them smell well, but there was this one, I thought it was genius urinal cake that actually had, like, it was like a slot machine, and then
Oh.
you could make it all go, and you try to make it like 4 strawberries in a row or whatever. So much fun.
See,
Or like
I
the
wish I
ice.
was I wish I could be a guy for one day.
You can.
Sheepy.
It's called the sheepy.
What?
I got one as a
No,
gift.
I mean, like,
It
have the
changed
member.
my world.
I want
It
the
changed my
whole
world.
man experience.
I used it
I
at
have
work.
I have one too, and I've used it.
Yeah,
You
and I was
used-
excited
Yeah.
because I was able to pee on a wall.
Did you write your name?
I tried, but it was like it didn't have the same force that a man probably does. So
That's like a giant. This is like a big funnel.
I was
Yes.
running with Mandy the other day, and there was snow out, and so I had to pee real quick. Made a heart shape. So exciting. And she goes like, "What are you doing?" I'm like, "Little heart shape for when you come back."
So Kegels aren't the only fixes for incontinence, correct?
Correct. You can have surgery. You can,
There's a sling, right, that they
A
can put
bladder
in.
sling.
Yeah.
Or bladder lift. Is that what it's called?
Well,
yeah,
I'll be
there's
honest.
both. There's both.
Okay.
Is what I read. So one is like a sling that actually gets like secured up to lift up the urethra. Is that right?
Well, yeah. So the purpose, because you have this vaginal prolapse, basically, and so your bladder prolapse, and so it's falling down. So you just need something to hold it back up. So there's lots of different ways you can do that. Surgery, devices.
They talked about directly into the urethra, like into a ligament. So they would sew it with a couple stitches, and then also with a sling. I also read some sort
Like
of
an arm
electrical
sling.
stimulation. Did
to
you read
help
that?
stimulate the nerves.
I guess, but that one kind of
Yeah.
creeped me out. It reminded me of like the weight loss belt that they used to have that people would sit on and it would like vibrate your body.
Yeah, that one I wonder because that doesn't work.
No,
It doesn't work like that.
but it's
So-
probably just some little machine that somebody's trying to make money off of.
Well, and rectal prolapse is a thing too, right? For this same problem, right? So when your large intestine comes out and
Ugh.
your digital reinsertion is a thing, or you can legitimately sprinkled granulated sugar on it,
Oh.
and that'll help too.
Yeah, I think
So
you
sprinkle a little
Like
sugar on it.
slug.
Yeah.
Well, that's exactly what happens, right? You put the granulated sugar on there, it pulls out all the water, so the prolapse shrinks, and it's supposed to shrink and help you push it back in.
Wow.
Dark high school science is what we're doing.
Well, I remember seeing a patient like this one time,
Yeah.
and she had a prolapse that was legitimately too long for anyone to try and push back in.
Yeah.
And the doc's like, well, let's just sprinkle some sugar on it. And I was like, okay, like, Mary Poppins style.
Do you go up to like the cafeteria and get packets? Like, what do you do? Hospital grade?
Well, so it does have to be granulated sugar. You can't use a sugar substitute, or like aspartame's not going to work, right? It
sugar
does have
in the raw.
to
Do you go sugar in the raw?
has to be granulated sugar.
I opt for the powdered.
Stevia, please.
Oh.
I don't need those calories.
God.
Oh, we've digressed.
Yes, we have. All right. Well, if you like what you saw or heard today, check us out on our podcast or YouTube.
Or visit our website, medicalconfessions.com.
This whole one, like, no bloopers will ever come from this episode.
It's going to be, why isn't there any bloopers at the end of this one? This seems like it should be rife with bloopers.
Appropriate for not appropriate at all. Nothing in between.
Yeah, we're like either way crossing the line or being way boring.
Yeah. I wonder if you would have been like all like straight laced and.
No, I wouldn't have been. It would have been my, I think, senior year. I probably wouldn't have got pregnant though. No, I'm serious. Because I would have been on the team.
That's what I'm saying.
That's
what I'm saying.
It's
like she'd be like a librarian right now.
No, I wouldn't. I was getting out of my bad state. I had gone through all my experiences.
If this was a TV show, I'd be like, brr, brr, and we'd be all like, now April's me. She's like little glasses.
It's like, oh dear.
Oh, hey.
Oh my.
My. I'm uncomfortable. Oh, how do you say that? He invented the Kegel what?
You can pronounce it like medical nonsense. How are you stuck, Scott?
Perineometer. So it's like your perineum. So it's perineometer. Perineometer.
Perineometer.
Well, I was struggling with like
perineometer.
Pubococcygenius. What the fuck is that? Sorry.
Pubic.
Sex organs are holding us up.
It all makes sense.
Parker came home and I was doing research on the computer downstairs at the table, and he is talking to me over my shoulder, and I was like, oh gosh, he's wondering probably why.
No, he's not. He's your son.
Yeah, it's true. I just got nervous for some reason because it was sexual in nature, and I don't know. He's like, I was like, oh, I'm doing podcast research. He's like, yeah, I know. And he's like, what are you doing it on? I'm like, Kegel exercise. He's like, what's that? And I'm like, well, if you should start doing them because it helps with anal leakage, incontinence, and it provides a better orgasm. And he just
said that to him.
Well, yeah. I'm educating him.
And then he was like, I'm in.
He totally turned around. He rolled his eyes. He's like, enough. Just stop. I'm done. I don't need to know about it. We should do a Kegel challenge.
I'm out.
You want to see how much weight you can lift?
No, well, yeah, kind of. I mean, when I read about that gals, I'm like, oh, how much weight can my vagina lift? Like, but I don't necessarily need to actually do it. But you can do Kegels without spending money. But, there's things out there that want you to spend money.
I'm going to stick with the push-up.
Well, we've talked about needing follow-ups for our podcast. Maybe this could be our first follow-up. How much weight can April lift? No,
I don't think so.
She just wants to be assigned like so many weeks of Kegels every day.
Yeah, I'll get Jess's feedback on if he notices anything different. I won't tell him I'm doing it.